Good morning, everyone. My name is Ashok Tamang, and I'm a nursing student in Western Sydney University. In this presentation, I'll be talking about heart failure. My presentation will also cover one of the high priority clinical manifestation of heart failure, and I'll also highlight the pathogenesis causing the clinical manifestation by drawing on the case study of Mrs. Brown. Finally, I'll be outlining in high priority nursing intervention to address the clinical manifestation of Mrs. Brown's heart failure case study. Firstly, here are some interesting facts about the heart failure. Heart failure doesn't mean your heart is not working at all. Heart failure means your heart is failing to work as it should and needs medicine to help it work better. You can take control of your condition with treatment and management of your symptoms and lifestyle. You can help to slow down the progression of your heart failure. You can still do many things you could do before. Many people with heart failure continue to work, drive, go on holiday, and enjoy sexually active lives. So what is heart failure? Now let's begin with the definition of heart failure. The National Heart Foundation of Australia and the Cardiac Society of Australia and New Zealand formulated the definition as a complex clinical syndrome that is frequently but not exclusively characterized by an underlying structural abnormality or cardiac dysfunctions that impairs the activity of the left ventricle to fill or eject blood. Thus, it is a progressive condition where our heart gradually loses the ability to pump enough blood to different parts of our body. This can happen in two ways. Either heart becomes weak and unable to pump blood, which is called systolic heart failure, or our heart becomes rigid and cannot fill the blood adequately, which is called diastolic heart failure. Ultimately, both condition leads to retention of extra fluid or congestion. One of the high priority clinical manifestation of heart failure is decrease in oxygen level. Why does this happen? The main cause behind this is because of pulmonary vascular congestion, which is characterized by accumulation of fluid in lungs, resulting in impaired gas exchange and arterial hypoxia. Understanding the pathophysiology of pulmonary vascular congestion will help us understand how heart failure leads to decrease in blood oxygen level. As heart failure is defined as an inability of the heart to generate adequate cardiac output to perfuse vital tissues, the heart rate and stroke volume plays an important role in maintaining the cardiac output in our body. Stroke volume is influenced by three major factors that are contractility, preload and afterload. When we have underlying heart disease such as myocardial infarction, the contractility of heart is reduced, which results in disruption of myocyte activities. Other causes of decreased contractility are recurrent myocardial ischemia and increased myocardial workload that contribute to inflammatory, immuno and neurohormonal changes mediating a process called ventricular remodeling. Stroke volume falls as contractibility decreases and diastolic volume increases, which causes expansion of the heart. Decreased contractility or an excess of plasma volume leads to increase in preload. As preload continues to increase, that causes myocardium to stress further and eventually lead to dysfunction of the sarcomeres and further decrease in contractility and increase in afterload. As the peripheral vascular resistance increases, there is increase in afterload that leads to resistance to ventricular emptying, giving more work for the ventricles, and this prognosis result in myocardial hypertrophy, and more oxygen is required to fulfill the demand of enlarged myocardium. In addition to this, hypertrophy causes deposition of collagen between the myocytes, which can disrupt the integrity of the muscles, decrease contractility, and make the ventricle more likely to dilate and fail. With a significant fall in cardiac output, it will impact on the renal perfusion, which results in diminished renal perfusion along with the activation of the renin-angiotensin-aldosterone system. This system is responsible for increasing both peripheral vascular resistance and plasma volume, which will further increase in afterload and preload in the heart. Then comes the role of bioreceptors. Bioreceptors in the central circulation, which detect the decrease in perfusion and stimulate the sympathetic nervous system to cause yet more vasoconstriction, and hypothalamus to produce antidiuretic hormone. This vicious cycle of decreasing contractility, increasing preload, and increasing afterload causes progressive development of pulmonary vascular congestion, where gas exchange is impaired between the alveoli and pulmonary capillaries, which result in significant decrease in blood oxygen level. That leads to hypoxia in the heart failure victim. So, what could be the high priority nursing in this situation? In the given case of Mrs. Brown, there is significant decrease in the blood oxygen level, which is deteriorating at 85%. So this is a clinical emergency for any nurse which needs immediate nursing intervention. Thus, high priority nursing intervention in this case is to focus in optimizing oxygenation and maintaining the symptoms of respiratory distress. To do this, patients should be positioned with head of the bed elevated in the semi-floor position as tolerated, in which head of the bed should be 45 degrees when in supine position. This is because upright position or semi-floor position allows increased thoracic cavity, full descent of diaphragm, and increased lungs expansion, preventing the abdominal pressure on the lungs. This intervention is followed by maintaining an oxygen administration device as ordered, attempting to maintain oxygen saturation at 90% or greater, because supplemental oxygen may be required to maintain alveolar oxygen tension at an acceptable level. In conclusion, heart is responsible for the peripheral circulation, maintaining the physiological function in each tissue by supplying adequate amount of oxygenated blood in our body. This circulation is disturbed because of the heart failure, where heart cannot supply enough oxygenated blood, resulting in hypoxia, which is evident in the case study of Mrs. Brown. It is vital for nurses to manage and maintain this exacerbation by timely assessment and intervention. So this is the end of my presentation. Thank you for your time. Thank you for listening. Thanks so much and have a wonderful day.